Hi, I'm Dr. Kurt Wohler from Adrenal Mastery. If you're like most integrative health practitioners, you are likely already seeing people in your practice who come in with symptoms of adrenal problems, specifically adrenal fatigue or adrenal exhaustion. There are literally millions of people, not only here in the United States but worldwide, who deal with fatigue on a daily basis, and more specifically have underlying adrenal problems, which is either a contributing or a causative factor to that fatigue. If you do online searches just in any search engine on the internet, adrenal fatigue, adrenal exhaustion, adrenal problems, etc., there are thousands of people searching on a monthly basis for those keywords. So the problem is huge. Now, conventional medicine generally only addresses adrenal insufficiency, or more specifically, Addison's disease. But as an integrative health practitioner, there are far more people out there who are dealing with this underlying problem of adrenal issues, adrenal dysfunction, than what would be classically diagnosed as Addison's disease. We developed this course, this 9-module course, in Adrenal Mastery to address those specific issues commonly seen in integrative medicine. What we go through at first is the comorbid conditions often seen in association with adrenal fatigue, whether it's allergies or eczema, other skin problems, digestive problems, sleeping issues, hormonal imbalances, tendencies towards autoimmune disorders, etc. All of these things are discussed and explored in how they interact with regards to adrenal problems. We also talk about something called the chronic stress response. Acute stress generally is handled in an appropriate way in the body by normal hormonal output. But chronic stress, which many people, and even us as practitioners, deal with, can have long-term health consequences in affecting hormonal levels that influence really all major organ systems of the body, whether it's detoxification or brain and nervous system function, hormonal balance, thyroid, inflammatory control, etc. We also talk about the staging of adrenal fatigue, adrenal exhaustion, in conjunction with the different types of tests that are available, whether it's blood, saliva, or urine testing for adrenal function. Now, saliva testing has been proven over time to be a very useful way of analyzing cortisol and DHE output, really as a dynamic test to be able to assess the functional status of somebody on a day-to-day basis. And so we go into that in great depth. Also staging people depending on where they are, stage 1, stage 2, stage 3. And more than just staging, this course is not a cookie-cutter approach to just sort of hand out a basic template, but it's to help you become a better practitioner in determining which stage your patient is in, but how their test results apply to their clinical situation. Because not every individual, based on the numbers on the test, is going to need the exact same amount of adrenal support. We go through the different types of adrenal support, the different supplements, what they are, how they're used, how they work biochemically, etc. And what are some of the contraindications that you need to be aware of when recommending such products. We also talk about medications that are also important to know about. Whether you can prescribe those medications or not, you as a practitioner still need to know how they're used and where they may need to be used in a particular clinical setting. We talk about also the relationship of the adrenals to other factors in the body. We go into how the thyroid is influenced by adrenal problems, how sleep is critically important as a factor not only to implement and try to improve sleep for patients who have adrenal fatigue, but how sleep disruption can actually worsen adrenal problems. One of the modules, we also discuss the relationship of sex hormones, in that if you're a practitioner who's working with individuals by doing sex hormone therapy, testosterone, progesterone, estrogen, why it's so critical that you also understand the relationship of adrenal function to sex hormone imbalances. We take it a step deeper as well. One of the things that I have felt for a long time, and as well as my partner, Dr. Trancatella, is that many people with adrenal problems often are not being thoroughly assessed for other metabolic imbalances, specifically mitochondrial dysfunction. And so we go into the relationship between mitochondria activity, which is producing that cellular energy currency that our body needs, our brain, our immune system, etc., but how it relates to adrenal dysfunction and vice versa. We also have a specific module that talks about neurotransmitter imbalances, how serotonin problems. I mean, people with adrenal fatigue often have depression or are susceptible to anxiety or depression. What is the relationship? How can approaching an adrenal program also address some of the neurochemical imbalances as well? Sleep is important, as we know, and the production of melatonin, which segues into this broader discussion of methylation. Now, you can take separate courses in methylation chemistry, but we're infusing a specific module into this course to show you the relationship between mitochondrial imbalances, between adrenal fatigue problems and methylation problems as well, because there is an interlinking of how these systems work. I also do a bonus lecture on the organic acids test, specifically the organic acids test from Great Plains Laboratory. This test is critical for practitioners who are doing adrenal assessment to know how to use, because both tests, whether it's adrenal testing and organic acid testing, complement each other incredibly well. And learning how to use this test in your practice in conjunction with your adrenal testing will increase your diagnostic capabilities significantly. The organic acid test looks at different markers of metabolic imbalance, from toxins from yeast and bacteria, as well as neurochemical imbalances, etc. It's also one of the primary tests we use as a screening for mitochondrial dysfunction. So this is more than just an adrenal course. This is an adrenal course with expanded topics to be able to help you as a practitioner understand the interrelationships of all of these different organ systems. Also part of this course, we have a tremendous amount of documents that are embedded within each module. This is office documents and program templates and protocols, handouts for patients, what we call brandable documents. These are documents that you can take and add your name, your practice logo to, modify it if you want, and use it as your own. We also have a very interactive forum. This is a unique service that allows you as a participant to come on a daily basis and post questions to the forum so that Dr. Trancatella and I can give us our feedback. Also, we have scheduled question and answer sessions. This is an opportunity for you to come on live and ask questions that can be asked of things that you're seeing in your particular practice. So there's a tremendous amount of additional resources that come with this particular course. So I encourage you, if you're interested in these topics, is to look through the information on the rest of this website and join us within this course for Adrenal Mastery. I think you'll find the information compelling, very informative, and also very interesting and practical for immediate implementation into your practice. Again, I'm Dr. Kurt Wohler for Adrenal Mastery course. Thank you very much.